Okay, logging right back on here to talk about phase 2 of the prep time for prostate cancer proton therapy treatment. And that's pretty simple. If you've had a CT scan, you know what half of it's like. If you've had an MRI, you know what the other half is like. A CT scan lasted about half an hour. MRI was 20 to 25 minutes. And a couple things they do in there. For one thing, on the CT scan, they have my legs initially laying on top of a pillow, or lying on top of a pillow, and that pillow would form to the shape of my legs. From that, they're going to make a mold that will be my personal mold, and every time I go for proton therapy treatments, which is going to be 5 days a week when they start, I will have my legs in that mold, and that will help to hold me in the same exact position every time over the 5 or so weeks that these treatments occur. That's painless. That was nothing. Once it had conformed to the shape that they thought was good, they had me lift my legs, they pulled it out, and then we continued with the CAT scan. During the CAT scan, they are looking to see where your prostate gland is positioned when you're lying in that position. And based on that, they make some marks on your body where the beams are going to be hitting you so that they can aim at the exact right places. And when it's all over, those Sharpie marks that they put on you are replaced with tattoos. The tattoos are just little black dots. They look like a small mole. They're permanent. You'll have them forever, but probably nobody will notice them. I had two on my sides in my hips, and then one right above the, I guess I'd just say the pubic area. And the two on the hips, the needle that they used, I didn't even feel anything. The other one, that's a little more sensitive area, and so I felt something there, but it was nothing excruciating. It felt like when the doctor draws blood for a CBC or something with a butterfly needle, or even just a hair being pulled, and it was over in a few seconds. And so that's that, and then there's the MRI that goes along with it. The only pain I had from any of this was just back pain from spending nearly an hour between the two procedures, lying flat on my back, unable to move on a hard surface. But you know, that's minimal. Anytime you get a CT scan or an MRI, you got to experience that. So nothing earth-shattering going on there. One other thing that they did was that they had me drink 24 ounces of water, gave me 5 or 10 minutes to do it. This was before the CT scan. And they have you empty your bladder before you drink the water, and then you drink the water, and they take a couple scans of your bladder to see how full it is. And based on that and the time factors and everything, they can determine how long it takes your bladder to fill up. They want your bladder full when you're doing the proton therapy treatments. And so mine came out 35 minutes. It took 35 minutes from drinking that 24 ounces for my bladder to fill up. And so what that means is if I say I have a 7 p.m. proton therapy treatment, I need to show up at 6:25, 35 minutes early, with the little cup they gave me, holds 24 ounces of water, and fill that thing up, drink it down, make sure I get that drunk down 35 minutes before they're going to take me in, and then they'll know my bladder is full to the right amount. So that's pretty much all there was to yesterday. Not a big deal at all. The next thing is they're going to contact me and set up my schedule, give me my day, what time I'll be doing it, 5 days a week, and then I'll start the treatments. I'll probably just make one of these videos after the first one of those treatments, because they're all the same, and everything I've heard, it takes just a few minutes and you don't feel anything. So no need to give you 25 or 30 more videos of that. That's going to get pretty redundant. Then I'll follow up as we go along, talk about PSA numbers and all those sorts of things that they'll be monitoring and how that process goes. So couple weeks from now, I'll be logging on after my first session. All right. Take care. God bless. Bye.